Yes?
I have two really young dogs, and they're massive chewers. And I'll throw them a Frisbee, and then it's gone. And I never know if I should just wait to see what comes out,
Yeah.
you know, if there's pink or orange, or if I need to take them in sometime. And it's rope and
Sure.
shoulders and
As having Labradors that do the exact same thing, I'm of the wait and see type most of the time. And that's if I know what they're ingesting. For instance, I know that they just chewed up some rug or something like that, or I know that they're chewed up the Frisbee. Most of those are in small pieces that are enough that they're going to come through. But you have to be really cautious, knowing that my dog's a chewer. If my dog is vomiting, a foreign body goes to the top of the list. I don't just blow it off as, oh, it's probably not a big deal. If they start vomiting, then that's the first thing I think of, because I know they eat things. I know that that happens. And so I'm more apt then to take them, bring them to my own clinic and do a x-rays and stuff like that and pursue it a little bit more aggressively. So I'm a little bit lax in that, okay, I'm not going to take them in just because I know they ate something, but I'm more aggressive on the other end if they start showing any signs at all of having an obstruction. The thing I'd be a little bit careful of is some of the different chew bones that we've seen that they're supposed to just come off in nice pieces, help their teeth, etc. But what happens ultimately is they bite off an end and they swallow it because it tastes good. They don't sit there and chew it like they don't read the directions. And so what happens is ultimately we have seen a high rate of obstructions both in the esophagus and of the intestines of those as well. So if you're giving your dog something like chew bones, dental bones, that type of stuff, know that all of those have a risk. Even the rawhides, etc., have risks. People say, well, do you give your dogs? Yeah, I give my dogs rawhides. My dogs love them and it keeps them out of my hair. But I know that if they eat that, there's always, always, always a potential for an obstruction. So if you know that you gave your dog rawhides or chew bones or something, and then that evening or the next day they're vomiting, I would be thinking maybe potentially a foreign body at that point.
Yeah. Is it less of a concern? I mean, I hear rocks come up.
Oh, definitely. Well, it's more of a concern because just like kids, I mean, you never know they ate it, and then it comes up, you're like, oh, great, what else did they eat? So if you don't know, it's actually better. But when they vomit it up, and even we'll do x-rays in dogs, and we'll see rocks in the colon, and you're like, wow, that went from there to there. So a lot of times we're finding these in hindsight. I am convinced dogs and cats both eat more than they should and that we know. The things to stay away from, though, are like cats. That's the classic example is cats with yarn or string or thread. Those types of things, cats will eat and play, and they classically will get foreign bodies, what's called a linear foreign body or a string foreign body. Stay away from those things for sure. Dogs are less likely to get that. They will, but cats are extremely predisposed to developing those conditions.